Welcome to our EC, the emergency center, where every moment is critical and every person important. Today, we'll be explaining how patients are prioritized and how the team works tirelessly behind the scenes for your sakes. Currently, on a daily basis, we see way more patients than we should have capacity to handle in the emergency center. That number increases significantly over peak times like after 4 p.m., weekends and public holidays. To make sure that the patients with the most serious, urgent and life-threatening problems are seen first, we use the South African triage system. It's a severity ranking system that is internationally recognized and used to assess every single patient in the emergency center using the same criteria. This assessment assigns a triage color to each patient according to the seriousness of their condition. Following this system is vitally important to ensure that doctors and nurses attend to the most severe illnesses and injuries first. Although Joshua is clearly in significant pain, his condition is stable and he is assigned the triage color green. This means he might have a long waiting time because the medical staff must attend to more urgent patients, usually those triaged red and orange first. Here we have a triage category red patient who needs life-saving care immediately or he will die. That makes him priority number one for all the staff in the emergency center. It's essential to get accurate information like phone numbers so that his family can be contacted and informed about any changes in his condition. But sickness and injury don't stand aside for others. Fever, wheezing, and a lack of appetite are worrying symptoms for adults, terrifying for children. After the medical staff assess her, she's assigned a yellow triage category. That means she'll receive the necessary medication according to her symptoms and be monitored by the medical staff until the patients that have been triaged orange and red have been attended to. Then it'll be her turn. After a lengthy wait, the medical team can finally examine Joshua to determine a diagnosis. Turns out his condition requires more investigations to confirm the diagnosis. The doctors use various types of technology like their mobile devices, computer apps, or a simple phone call to do things like book investigations, to check the patient's lab results, or to refer patients to specialists. In Joshua's case, the attending doctor will be using his phone to book the necessary investigation. They're also welcome to go home. A hospital team member will contact the family if there are important developments or information that needs to be shared. So adding to a growing list of priorities, Esther, a 76-year-old woman with a fractured hip, has been brought in via ambulance. And although she can't be seen by the patients in the waiting area, she does add to the list of patients who must be prioritized and seen by the medical staff, which means waiting times could be longer for people triaged with green and yellow. Our attending medical staff are working tirelessly to save lives and give their full attention to every single patient whenever and wherever needed. Once patients are stabilized and vitals are being monitored, our teams move on to help other patients needing care. Looks like a viral infection, which means our little patient is going to spend the night and be closely monitored until a pediatrician can come down and assess and decide on further treatment. Doctors will refer patients to specialists or other areas of care where appropriate. This patient is being referred to the outpatient department for further care, and he won't need to spend more time in the emergency center. How are you feeling, Esther? Painful. Esther is going to need surgery, but before she can be operated on, she needs to be admitted. And while our orthopedics team is preparing and arranging for her surgery, she's going to be taken care of here in the emergency center. And Esther, you're in great hands. Our team in the emergency center work tirelessly to make a real difference in people's lives, often setting aside their own needs for the needs of their patients. And they don't do it for recognition or reward, they do it because they really, really care. In this high-pressured environment that is the emergency department, every second counts, every decision is crucial, and every single person matters, no matter who you are or where you come from. Which is why every day here at the EC, lives are touched, lives are saved, and forever changed.